Hello, my name is Venice Valderrama, and this is an informative speech on defining what is a healthcare manager. A healthcare manager creates the foundation to the facility or department in which they manage. Medical managers plan, direct, and coordinate medical and health services. They might manage anywhere from an entire facility, a specific clinical or department, or even medical practices for a group of physicians. Medical and health services managers must direct changes that conform to changes in the healthcare laws, regulations, and technology. Most medical and health services managers work in offices and healthcare facilities, including hospitals, nursing homes, and group medical practices. It is important to know that medical managers require skills of organization, time management, and leadership. Organizational skills is very important simply because when managing a facility, you have to be organized in making sure that all paperwork, all records, and staff, complaints, etc., is kept organized on a daily, monthly, even a yearly basis. Leadership. It takes a great leader to lead a staff of whether it's 20, 30, 100, or if you're running a whole hospital, thousands of workers. You have to manage and oversee the staff and making sure that they are providing quality and efficient services to those that you are servicing within your community. It is said that time management is very important in any job that you do. But with the fast moving services that's provided in healthcare, the changes in technology and in rules and in medicines, it's always good to understand that time management is important. You must manage your time in order to give that time to your staff and ensuring that they have everything that is necessary to make sure that their job is easier so that they can provide so much more. Without time management, you'll be all over the place. Without great leadership skills, no one will follow. If no one follows the management of a healthcare service manager, how is that facility going to be ran? That facility will be all over the place and wouldn't be able to provide the services that is required from us. According to BLS.gov, by the year 2026, it will be a 20% job increase. 20%. One of the fastest growing, according to this here, one of the fastest growing occupations in the United States. Why is that? Why is it one of the fastest growing occupations? Baby boomers. Baby boomers play a pivotal part of the population. And because of the aging, it's going to be required more hospitals, more nursing homes, and long care services to give to these baby boomers. Not just baby boomers, but everyone. The population is growing here in the United States. It's going to require more services to the public. It takes a strong leader to lead a staff and making sure that the quality of services that we provide or in any medical field is up to par. It's also said that to become a healthcare manager, it is required that you have a minimum of a bachelor's degree. So that's 4 years of educational training. While most go on to get their master's degree, entry-level management requires a bachelor's. Skills that I would say are very important, not only leadership, time management, and communication skills, but understanding While many may assume that understanding is not a skill, yes, it is. You have to understand what is it that the doctors need, what is it the nurses need, how and when it's needed, and why. So yes, understanding is a skill. They say that it takes a village to raise a child. But in the medical field, I say it takes a great group of staff members to provide the quality healthcare services needed. No one wants to walk into a clinic that's disorganized. No one wants to walk in a clinic that doesn't have the supplies to provide services for the community. That's what the managers do. They work behind the scenes, along side by side with the doctors, and making sure that everything, and when I say everything, is there. Whether it's managing supplies, whether it's managing time, whether it's managing anything. Anything that is going to provide quality services to the community is what we do. So while many may assume that it takes doctors and nurses and other medical staff to keep the hospital running, you're right. But it also takes the help of a healthcare manager to ensure that everyone works together on the same path, on the same page, with the same goal in mind. And that goal is to provide exceptional services, adequate services, and efficient service to the public. That's defining what a healthcare manager does. Thank you.